Hi, my name is Aileen Cabe and I am the practice support nurse for the General Intensive Care Unit. Recently in the General Intensive Care Unit we started an initiative with the speech and language therapy and physiotherapy within the department and across the hospital, and it is to provide each trachea patient who leaves the intensive care unit with a tracheostomy box. We are also doing trachea rounds and ensuring that patients who come to the hospital with a tracheostomy will ensure that they do get a box and are picked up for the need to have a tracheostomy safety box. So the box is blue, it's plastic, it's cleanable, and it's got a clear top. On the top of your box you will have a contents list of what should be in it. You will also have some little signs, which is the number of your box, and also a little sticker to say that it should be returned to the intensive care unit. What is listed in the contents of your tracheostomy box should be the only thing that is in it. It's very important to emphasise that, because in an emergency you need to know that you can clearly identify equipment and safely access that equipment. So you take the box off, I'll go through the contents of it. So when you receive a patient from the intensive care unit, you will receive signs. You'll receive 3 signs. First one is the identification of if it is a tracheostomy or a laryngectomy. So it's quite important that you do know what type of a patient you are dealing with in regards to their artificial airway. So this is a tracheostomy sign, and it can be got from the physiotherapy department, or you will and you should get it from the intensive care unit when you receive your patient. On this you write out the details of what type of a tracheostomy, if it's a surgical or a percutaneous. By surgical we mean that it is an ENT tracheostomy, its size and the MRN number of the patient, and this is then put at the back of the patient's bed. You will also get an algorithm. This is the emergency tracheostomy management algorithm. It's a very important algorithm as it helps you to care for your patient in an emergency situation for their tracheostomy, and it's quite important that you are familiar with it and you access it and you keep it at the back of the bed in the case of an emergency. You will also get a checklist. This checklist will be available on QPulse, so you can download it. Like every patient who has an artificial airway, it's very important that you check your safety equipment daily and per shift. So this is a record of the equipment which you should need and have by your bedside. The first part is just the contents of the tracheostomy box. The rest of it is safety equipment which you supply yourself by the bedside of your patient, and it's quite standard safety equipment for airway management. So it's quite important that per shift this is documented and you keep it with your patient's notes when your patient has been discharged or they no longer have their tracheostomy. So within your box, you will receive your patient and you need to know the appropriate size of the tracheostomy to have and what you need to have by the bedside in regards to a smaller tracheostomy. So you'll have the same size and a smaller size. Both should be cuffed. You will have a trachea dilator. This is a disposable trachea dilator and it's for single use, and you can see it's got the non-reusable sign logo on it, so it's quite important that it is identifiable. It's got a paper back on it, so if you do use it in a room of an infected patient, you have to throw it away even if it's not open because it's not completely plastic. You will also get a cuff manometer to check the cuff pressure of your tracheostomy. You will get a spare inner cannula, so depending on what type of brand that your tracheostomy is, you need to have the appropriate inner cannula to the appropriate size which your patient currently has in situ. You get one of those. You will also get standard equipment, such as you will get a dressing and a tie to keep your trachea in place. You will get cleaning brushes, and you will get a little holder which is to hold your temporary inner cannula, because this is only for cleaning while you are, this is only for placement while you are cleaning your tracheostomy, your inner cannula of your tracheostomy, which is already permanently in situ. So you then have a few more items. You have spare 2 lubricating gels, and you have a 10 ml syringe. These are in the pack in case that you need to reinsert a tracheostomy. So in an emergency situation, when a competent individual comes to the bed space that has the ability to reinsert a tracheostomy if necessary into the stoma for airway management, you will need to have a 10 ml syringe to inflate the cuff of your tracheostomy, and you will also need lubricating gel for the smooth insertion of that tracheostomy. If you had a dislodgement of your tracheostomy or your tracheostomy fell out, and this is seen in the algorithm, you may need to, for the safe management of your airway, to cover up the stoma of your tracheostomy. So for this, you will need to have gauze and you will need to have sleek, because it will prevent an air leak from it and allow you to ventilate your patient unless they're a laryngectomy from their oral cavity down into their lungs. So it's quite important that you do have these spare pieces of equipment within your box. And your box is then empty, and it's quite a nice size, so you can keep everything in it, and really that's why it's important that only what is in it should be kept in it. When your patient has been decannulated or they are discharged to another hospital, you don't send the tracheostomy box with them. You give the tracheostomy box back to the general intensive care unit because they will reuse it for the next patient. You do not give any equipment back which is disposable. So the only thing that is returned to the intensive care unit is a clean box with a lid, a manometer, and if appropriate, or if you have not given it to the physio department, you should also return the laminated signs. So if they're not laminated, you can't return them for infection control reasons. But if they are, they can be cleaned down and they can all be returned and just dropped back to the intensive care unit and inform one of the nurses who is in charge. And that is it. If there is any problems with your tracheostomy box or with your tracheostomy, you can let your speech and language therapist know on the ward, your physiotherapist, or you can call down to the intensive care unit. All stock for the box is available from stores in Beaumont Hospital. Thank you. The next thing I just want to show you is that within Beaumont Hospital in the next few weeks, there will be the introduction of a new tracheostomy. So this is a Shiley tracheostomy, which is familiar to most people. It's one which we already have within the hospital. However, now the difference is that it'll be standardised. This will be the only tracheostomy used. This one I'm showing you at the minute is a cuffed tracheostomy, but the cuff is deflated, so this is a cuffed one. And the difference is that the inner cannula is disposable. So it's a clip-in, and when you take it out, you throw it away. So this is your disposable inner cannula, and on it, it says do not clean or reuse. So this is very important. It's part of the new infection control measures for tracheostomy care within the hospital. But it's very important for you to realise that you cannot leave your tracheostomy without an inner cannula. Otherwise, no bag valve mask or any C circuit will connect to it, because you need to have this universal top on it for this airway management bagging system to connect onto. So it's a clip in, and you just hold both sides and you clip it in like that, and it's quite firm. Try to avoid pushing it, because that's very painful on the stoma of your patient, and they will feel like their airway is being occluded. It's very uncomfortable for them. So you squeeze both sides and you withdraw it, and you squeeze both sides and you insert it nice and gently. And it's not very difficult, and it will stay quite secure. It'll come in non-fenestrated and fenestrated, and always remember it's important that if it is a fenestrated tracheostomy, which is one which has holes in it, you always need to use a non-fenestrated inner cannula when you are doing suctioning. So it's quite an important thing to remember. And they will come cuffed and uncuffed. And they're throwaway. And that is it.